Hello, my name is Miriam, and I am glad today to have this opportunity to present the research that I have been conducting these last few weeks regarding osteoporosis in Japan. So, this is my poster about osteoporosis in Japan. So, I'm going to start with a small introduction. So, osteoporosis is a health condition that weakens bones, making them fragile and more likely to break. It develops slowly over many years, and it's often only diagnosed when a fall or a sudden impact causes a fracture because actually the bone is a living tissue that is constantly being broken down and replaced. And so osteoporosis occurs when the creation of that new bone doesn't keep with the loss of the old bone. There is a small background regarding Japan. So this country is considered as a major aid donor as well as a source of global capital and credit. And almost more than 3/4 of the population, they live in places that are covered with buildings across large areas on the coastal fringes of Japan's islands. And so the country is known to have the longest life expectancy in the world and also the longest healthy life expectancy. And some unique features of dealing with osteoporosis in Japan include the rare use of estrogen replacement therapy, but the use of vitamin D and the use of calcium and calcitonin in low dose are the most common treatments in Japan for this health issue. And so the emphasis on the use of calcium, vitamin D, and those supplements in the treatments of osteoporosis can be explained by a very low dietary calcium intake in Japan, because Japan is known to have very low intake traditionally. So here now I'm going to take about some prevention approaches. So in order to deal with osteoporosis, Japan needs to focus on some primary and secondary preventions approach. So for the first primary intervention, it consists in creating a lifestyle change planning program with some educational sessions for people to help them understand better the different ways on how to prevent this disease. And also this program is going to include some usual way of life suggestions, topics, and resources to stay healthy, such as quitting smoking, doing regular exercises, and limiting alcohol consumptions. Then the second primary prevention consists in making people aware of the importance of taking the correct amount of calcium and vitamin D, which are used in the optimization of bone health, and they are often overlooked by patients and healthcare providers. Actually, those supplements, they help in preventing and treating osteoporosis, and it has been reported that lower levels of vitamin D are actually independently associated with an increased risk of falling for old people. And in fact, supplementations with vitamin D has been shown to improve musculoskeletal functions and also at the same time reduce the risk of falling. And vitamin D, it decreases the bone loss, and also it lowers the risk of fracture, especially in old adults. And so that is why it's important to know the correct amount to take, because the adequate vitamin D is needed for efficient calcium absorption. Regarding the secondary preventions, the first secondary prevention, since falling is more hazardous for people with osteoporosis than for those with healthy bones. So some people are more likely to break a bone in a minor fall. That's why like showing some suggestions such as addressing anything that could lead to fall in their home environment, like for example, slippery surfaces, loose rugs, tripping hazards, or furniture would be very helpful. Then the secondary prevention would be to set up some biweekly meetings between patients who are suffering from this disease and professional nutritional counselors, because patients are usually bombarded with information from the internet, family, or friends about what is good and what is bad for their health when it comes to nutrition and diet. Then here, this graphic here, it represents the number of female patients receiving free osteoporosis examinations at municipalities in Japan in fiscal year 2021. So actually, municipalities in Japan, they provide every year osteoporosis examinations for free for female patients whose age vary between 40 and 70. And here in this graph, the statistics depict that 45,000 women in Japan underwent free osteoporosis examinations and were advised to undergo detailed re-examination in that fiscal year 2021. And actually, this number is accounted for about 15% of the total free osteoporosis exams conducted in Japan during that year. Now I'm going to talk about some challenges and recommendations on how organizations can work to prevent or reduce this healthcare issue. So the first challenge that an organization can face is the lack of patients' motivation in making lifestyle changes. There can be some patients who are unwilling to change their habits. A recommendation would be to have some professional coaches who can make sure that patients stay accountable for their goals and timelines, and also understanding their motivation on what inspires them, and that will ultimately will keep those patients going and reaching a healthy lifestyle. Then a second challenge can be the lack in data management and its relation in keeping up with the latest findings and information that are related to the prevention and treatment of osteoporosis. In today's digital economy, there are numerous organizations that possess access to more data than ever before. And so a recommendation to tackle this issue would be to identify organization goals to prevent becoming unmanageable and focus more significantly on the quality of the data. Then the third challenge that the organization can face is the cultural and social issues, along with the lack of knowledge of what is osteoporosis for people with different backgrounds. Because there are some people who still possess deeply rooted traditions and cultures about the lack of trust for professionals or social beliefs about certain behaviors. And a recommendation to help reduce this issue would be to make a conscious act in understanding these norms prior to any program within an organization that is trying to prevent this health issue, because inadequate knowledge and positive health beliefs about osteoporosis will surely encourage individuals to adopt the necessary measures to protect bone health. So in conclusion, I can say that this healthcare issue, it has a massive impact at the individual and population level globally. Addressing osteoporosis has become a very urgent issue in Japan due to its fast aging society. And medications, healthy diets, and weight-bearing exercises can help prevent bone loss or strengthen already weak bones. And also knowing how to bring inducements to people in order to change their lifestyle habits, along with having some professional nutrition counselors within organizations in the country, can be very powerful in helping the prevention and management of this chronic illness. And so here, those are my references and my discussion posts. And thank you very much for watching my video. If you have any question, please feel free to make a comment below. And thank you again very much for watching.